Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the exercise, how exercise lowers the blood glucose, and what are the physiological changes during exercise, and evaluation before prescribing or recommending any exercise program to the people having diabetes mellitus. So the key feature of type 2 diabetes is insulin resistance, which is the body inability to respond properly to blood glucose lowering effect of insulin. So resistance to insulin occurs in tissue of body like uh, fat and muscle where glucose is taken up from blood. So exercise acts to decrease the insulin resistance, making cell more sensitive to circulating insulin and lowers the blood glucose level. So physiological changes during exercise depend on type and amount of time spent participating in any activity. Like during the first few minutes of exercise, at that time the glycogen, which is the uh, glucose stored in muscles, is broken down anaerobically and used to fuel the muscles. So as physical activity continues, oxygen becomes available for aerobic breakdown of carbohydrate, fats and proteins. And after 5 to 10 minutes, then glycogen breakdown decreases and glucose breakdown in liver is released into bloodstream and taken by the muscles as a fuel, so which become a major source of fuel, that is glycogenolysis hepatic. And after 20 or more minutes, now the glycogen stores are depleted. Blood glucose is now maintained by glycogenolysis and triglycerides, which are broken down from adipose tissue. As exercise continues, fat breaks down to free fatty acids and is used as a fuel for muscles through a process of gluconeogenesis. Longer duration, if low to moderately intensive exercise continue for long period of time, then muscles will continue to use glucose derived from gluconeogenesis like free fatty acids as fuel, and they cannot completely replace the use of glucose, and if carbohydrates are limited, then ketone bodies may form. So this is not a risk in a person who has enough insulin, but may increase the risk of decay in person who is insulin deficient, such as type 1 with elevated blood glucose. So if carbohydrate is consumed during exercise, there is decrease in the blood glucose that can be delayed and exercise can be sustained for longer period. This is often done by people with diabetes who are on marathon runners or engage in moderate or intensive exercise for long periods of time. So those who are performing moderate to intense exercise, they find their blood glucose drops, causing hypoglycemia several hours after they have exercised. It occurs because glycogen stored in muscles need to be replenished after activity is completed. So muscles continue to pull glucose from bloodstream for several hours. So this is the period of time during which person with diabetes is most at risk for developing the hypoglycemia. As muscle glycogen is restored, increase in insulin sensitivity occurs. So sometimes the person with type 1 diabetes may see a rise in blood glucose with exercise, which occurs when person starts to exercise with a blood glucose level that is already too high and indicating there is very little, if any, available insulin. So deficiency of insulin leads to counter insulin hormones which trigger the liver to release additional stored glucose, resulting in an increase to already high level of glucose and ketones. And people with elevated blood glucose level who don't have ketones in their urine should be advised that they can exercise with caution as long as they feel well and are not dehydrated. If after 10 to 15 minutes blood glucose level decrease, it's okay to continue with exercise, but if increased, person should stop exercise. If there are ketones before exercise, then exercise should be avoided or postponed until ketones clear or blood glucose level improve. Aerobic and aerobic exercise training increase the muscle capillary density with higher concentration of glucose transporter, and which are found to result in improved changes in fasting insulin concentration and glucose tolerance. Also, aerobic exercise training is effective in reducing the abdominal fat stores and triglyceride level. Like a single session of aerobic activity on insulin sensitivity lasts 24 to 72 hours depending on the duration and intensity of exercise. An effect of resistance exercise may last longer because effects are mediated by increase in muscle mass. Especially from resistance or anaerobic activity increase, it improves the insulin resistance by increasing the glucose storage space in the muscle. So next we are having the evaluation before prescribing any exercise regime. So more sternest than the current pattern of exercise, a person with diabetes should undergo a medical assessment which will screen the presence of any micro or macrovascular complication, and by identifying the presence of the complication, one can develop the exercise program which minimize the risk of person of worsening their identified condition. Like a graded exercise test should be seriously considered before a person who was previously sedentary start exercise that is more than brisk walk if a 10-year risk of coronary event is likely to more than 10%. Then Canadian Diabetes Association guidelines suggest that ECG stress test to be performed in sedentary people because they are at risk for cardiovascular disease and like they are wishing to start any exercise. Also the physical activity questionnaire to assess the fitness of the person, and also not specifically developed for diabetic people. It is a tool which can be used to determine if further medical clearance is needed before any exercise prescription. So this is the physical activity readiness questionnaire, also known as the PARQ. So with the help of this we can evaluate the fitness of any person, an individual. Next, sitting through life increases the risk of heart disease, high BP, high cholesterol, overweight, type 2 diabetes. Also sitting is the new smoking in today's era. So we now should plan or must plan physical activity into our schedule. I think all of us should plan to include the physical activity into our schedule, not only the diabetic people, because of the risk of having so many complications or so many diseases in the future. Thank you.